Now talking about smart document. Before I go ahead, I'll tell you something very important. A lot of you people are using EHS, which is not an AI-based solution, because EHS is just something where you manually entry and you get the data printout. I mean, it's more like a glorified typewriter or a computer that we're using. We hardly use it to do anything. Once ABHA comes in, ABHA is the health Aadhaar card for an Indian population. We have created an over ABHA. You can do it, it's voluntary, it will be mandatory within 2 to 3 years, where a patient would have his own ABHA card, which is like an Aadhaar card without which health records will not move. They will all be digitalized and they will move from hospital to hospital under the Ayushman Bharat scheme, which the government is going to make it very compulsory. They've already started an office in Pune. So why smart documentation and how ABHA gets connected with AI, I will tell you very soon. First, let's understand why smart documentation is important in AI and how does it help the patient. The problem in documentation today is one, if you don't document, you would not be able to get back to your patient data. Medico-legally, you need to have a very smart documentation system. If you do not have it, you're going to ask for trouble, because when you land them in court, courts don't see what you have done, courts see your paperwork. Now the problem is when you're documenting, a lot of time is spent in documentation. If you go to any corporate hospital, you will see that the nursing staff in your own, and we are all NABH, and yesterday was my NABH inspection of my hospital, 80% of the energy is spent in how did you document, why did you document, why not that, how did you do that? I mean, it's maddening, you would like to spend 10 minutes diagnosing a mitral stenosis or understanding the diabetes glycemic variability rather than jotting it down how and why it happened. So that is something either you do or you keep an RMO, assistant officer under you, or a trained nurse under you who has a potential of shifting your patient to their own clinic after some 5 years of training from you, etc., etc. And it's a big burden on you. So this is a crisis of documentation, and if you see the reality across the planet, 4.5 hours every day is spent by the clinician. 63% clinicians get fed up just entering and data, and the amount of money you spend is huge, and unnecessary amount of money is spent. Patients don't understand your jargon. And see, suppose Dr. Shambhu is my, I'll put the scene. Suppose I am Dr. Shambhu's patient, and I tell him, look boss, I've got some chest pain. It's nagging, it's coming with nausea. He says, Acha. When did it come? Tuck, tuck, tuck. Does it increase or decrease? Tuck, tuck, tuck. Acha, did you get it in the morning? Tuck, tuck, tuck. Does it increase or decrease after eating food and walking? Tuck, tuck, tuck. So what the hell are you doing? I'm coming to consult you. Then he looks at the computer, takes a printout, and my patient told me, ये डॉक्टर को कुछ आता नहीं, वो कंप्यूटर इसको बताता है, वो देख के बाहर निकालता है. This is the reality of today's working in engaging the patient through a written work or a paper work or keeping records. So there is a huge amount of patient gap, and patients don't get connected with you, and what jargon you're printing out, naturally the patient doesn't understand. So this kind of a documentation system that we are having today, it's overloading the patient, it's stealing the focus from care to something which does not exist, which is mandatory on the healthcare provider and the legality, and naturally you practice defensive medicine, so that matters. So you always dream of a system where I and Shambhu could have a eye-to-eye connect, and if he were a lady, I would love to have a better eye-to-eye connect with him and probably get things moving, and I would come and tell my wife what a fantastic doctor I have met, and he put a hand on his shoulder and he looked at me, और मेरी बीमारी दूर हो गई, And I get a prescription which makes sense to me because he is busy talking with me. So your chest pain comes on the left or the right, and don't worry, I'm there to take care of you. And every time he is talking, somebody is working in the background documenting things and taking care of things in a scientifically valid, accurate and pragmatic manner. That is the role of AI. Why AI? Intelligence. AI is intelligence. It's artificial intelligence, which we fondly call as augmented intelligence or additive intelligence. So this is one aspect of AI which transfers it into clinical documentation. So what are these AI? Agentic AI, something called as an agentic AI, which is an ecosystem of AI on its own. These are the new medical assistants. So what they do is they just listen. So you guys are listening to me, you guys are assimilating what I'm saying, it is making some sense to you. The AI works like an intelligent partner. It listens and makes sense, it processes that information. So if you have seen some good AI tools in action, when Dr. Shambhu tells me, so does your chest pain increase after food or does it increase after walking? He's referring to angina on effort. So AI understands that if I say yes, that means I'm having angina on effort, that means it's most likely a coronary problem. And suppose he tells me, do you get chest pain, which is accompanied by nausea, and it does not go away when you take rest? AI understands that this could be an inferior wall myocardial infarction, where the chest pain component is less, but the gastric component is high. But an AI cannot be ruled out, and it documents all that. All this happens seamlessly in the background and does a lot of work. It makes a huge impact in clinical practice. 550 plus clinicians in U Chicago found it fantastic. 90% of them paid a huge attention to it, and there was a satisfaction score of 71%. So the bottom line is, you're going to focus on the patient. You're going to focus on the behavior of the patient. That communication is 90% is body language, 10% is the words. So when you do this kind of a pragmatic communication, जो बोलते हैं आँख में आँख डाल के बात कर दो. I like to be a little humorous in my talk. Even if it is a guy, we both are guys, but when we look into each other's eye, we connect better on a professional platform. So just to clarify what jokes I'm making on that level. So AI freezes you to focus on the patient's body language and focuses the patient to focus on the doctor's body language, comfort each other, have a pragmatic, scientifically professional conversation, and get out of the consulting room with your paperwork running in the background, which is medico-legally, ethically, and professionally and medically safe. So AI also does that, and then AI can convert it into patient education materials. So suppose after making a diagnosis of probably a myocardial infarction, an inferior wall myocardial infarction, which is stable, I would like to know what is it? What kind of future do I have? What kind of treatment do I deserve? And why am I getting an aspirin and clopidogrel? And why am I getting an atorvastatin? That patient handout gets prepared automatically. Now see, we're talking of precision medicine or personalized medicine. So it's not a standard pickup from the Google and print out to all the patients of MI that come to Dr. Shambhu's clinic. It is personalized for Dr. Alok Modi because his symptoms are different from maybe Dr. Ritu, if you pardon me to label you as inferior wall infarction. Somebody like that, I'm making a guinea pig out of her, so sorry for that. So that becomes personal, and that education material is ready, pushed on the patient's WhatsApp through API, pushed on the patient's mail, and handed over to him from a clinic, from a wireless printer sitting outside when the patient walks out. And this simplifies patient education. It increases the patient connect with the doctor. It increases the reading level from grade 10 to as low as grade 5.6. The word count, there's something called as word count. There is something token. When you work on ChatGPT, the number of tokens you give, that elevates the cost of an AI. So what is this token? This is called transformative AI. I'll just give you a little bit about what is transformative AI. So, there are some people who read books very fast. Like I could read I was known as a walking, talking Harrison. I could finish the entire Harrison in probably 1 hour. Not that I was a great, big person. I could finish the Harrison in 1 hour only because there were a lot of words. So when I say, I went out with my wife on the side of Ganges River and I had a lovely onion bhajiyas and a lot of good adrak ki chai. So there are some words which need not be spoken. The message is clear when I say, I went on the side of river Ganges. I say, side of river Ganges, onion bhajiyas, good chai. The meaning is there. It may not convey sense, but for a machine, you don't have to give emotionally. So a lot of words are cut down. So that is called transformative. It picks up what is relevant and a lot of crash is removed. So the size gets cut, the communication gets speeded up, and the conversation becomes more scientifically accurate by cutting off a lot of nonsense from there. So that transformative AI happens, and that is a part of NLP, natural language processing. So that natural language processing is something else. It converts a text, audio, or a video to text, audio, and video back to you. So a human being communication goes from an AI back to a human being communication, which a normal computer cannot do. And that grading level grade, which I'm talking to, can get reduced. So people having a low grade with after reduction of word count, the AI gives sense to them and makes a good help to them. So now if you look at your discharge summary, it's loaded with Hep B positive, Hep A negative, and child score so and so, NYHA class 3-4. Patients doesn't understand all that. They think it's all garbage for us. They go to a lawyer and they get frustrated. If the whole thing could be crystallized in a very simple manner, and a medical jargon discharge summary could be kept with you, but a medically jargonless discharge summary could be kept with the patient, would convert into a difficult patient into a very affordable and a very lovable patient. And all this you cannot do, your assistant cannot do it. It increases your load like anything. AI can do that at a very high speed. So that challenge gets solutionized, and the impact on the patient is huge. The connect with the patient is huge. Adherence to the doctor and the treatment increases by 23%. So the complex scenario in a medical ecosystem today, in a medical hospital or a medical training college today, becomes a very simple, easy to assimilate and get better work done to clarity. And I would like to add here something from my experience. So if your wife or if your husband is not cooking food for you, you will start going to Swiggy and Zomato. You will spoil your tummy and increase the monthly bills. So Swiggy, Zomato are forced to creep in because hunger is a necessity, but you're not getting home food. Not that you don't want to eat home food. I wish my wife was here because she feeds me very nicely, but yet I go to Swiggy, Zomato. So coming back out of humor, so when you give simple discharge summaries and simple communicative languages, which makes sense, people are less inclined to go to nonsense apps and media and complain on social media about the doctor. So it does help over there. This is shown in the Western world. Bottom line is your burnout is reduced. So instead of spending 1 hour for one patient in the hospital, you probably spend 15 minutes, and the remaining 45 minutes probably you'll be happy to spend with your spouse or your girlfriend or boyfriend, and probably you'll spend in a casual faculty room having a good time over there. So the documentation burden, which drives burnout and errors, gets reduced significantly to the tune of 70 to 75%. And you can use all these LLMs. LLM stands for large language model. Now these are generic LLM, ChatGPT, Perplexity, and Claude. You can use even those, but when you train them on a medical literature, which Google has done recently, and Microsoft has come out very recently, if you have been following up our tech groups. So these are medically trained, medical literature trained LLMs, which do a fantastic job, and they can be used to incorporate and add up to your EHS system and give you meaningful, senseful, intelligent outputs. So when you understand the system, artificial intelligence reduces the load of both the patient and the clinician and the paramedical staff. It gives you an overall accuracy, privacy, and trust. Question that you can ask is, everything has been taken over by AI. What is my role except to nod my head? No. It is a doctor or the human in the loop which is important, because whatever data is generated, output is generated, has to be approved by you. Unless you approve and you oversee it, it will not get passed through the channel. So unless you sign it and approve of it, it will not move further. So the transcription, approval, draft generation, and the reviews, everything is in your control. So clinician oversight becomes very important. Another important aspect is data privacy and data security and data ownership. That data always belongs to the patient. You are one of the intermediaries handling the data. Your paramedical staff handles the data. But when data moves from a doctor to another nurse, what happens to the security? So a lot of blockchain technology comes in and AI takes care of it. So the data gets encrypted, it gets decrypted, re-encrypted, and decrypted, and whatever data is collected, whatever work is being done is deleted the moment that work is done. So the prompts that are required are deleted. Control accesses entirely with the patient. Limited doctors will have limited control, limited paramedical staff will have limited control, and all this becomes highly HIPAA compliant. So this is the core of an AI documentation that remains very secure to your server. It doesn't become universal. And even when insurance companies and ABA comes in place, there will be blockchain technology, which means there will be blocks at each step. Whatever data needs to move from one block to the other only will be authorized to move as per the authorization set in place. Everything will not move without the consent of the patient. So it becomes highly secure. Bottom line is, when you implement this system, there is a better patient engagement, there is a better documentation. It can integrate from a Windows OS to a Mac OS to an Android OS or a Chrome OS. It can integrate from various sensors. It can integrate from various EHSs, whether you're working with Medeva or DocOn or any other EHS or which is there in the market. Only AI can integrate these systems in a very seamless and a practical manner and customize it to suit your clinic. And depending upon the use cases, you can get a real-time decision analysis, you can get an automated follow-up. So whatever data paperwork you have done through AI can follow up with that patient. Okay, look boss, you had inferior wall infarction, you got admitted, you got discharged. How are you feeling today? It will send a WhatsApp message to follow up, and patient can reply like you have airlines following up. What was your experience after deplaning from Air India? Did you have a good cabin? Did you have a good air hostess experience? Did you have a good check-in system at our, you get those WhatsApp messages where you answer 1, 2, 3, 4 and all that. So that follow-up will come automatically to your patient on your behalf, and it will also send an interactive education. So here I would like to talk about Dr. Bharat Saboo's Mitra, for which he recently got an award in ADA just 2 months back. Mitra is a fantastic chatbot that he has created. We part of DocYantra, and Dr. Harsh is very much here. Another author is here. Unfortunately, I'm also the third author of On a Humorous Ground. So we have worked on all that, and that has got an award, and it works so well. It can interpret that you're getting SGLT2, you're getting some kind of a urinary tract infection, so should you stop it or not? It takes care of all that. So it reduces your burnout and tells you, do not stop your SGLT2. Now it's time to consult your doctor because things have gone at that level. So bottom line is you're creating an ecosystem with AI, which is legally valid, which is scientifically valid, which is absolutely secure, which reduces your burnout, which reduces the patient's burnout, increases the body language interaction between the two partners of the ecosystem, makes for a better patient and a better doctor. And at the end of the day, you can take time out for your family and friends and enjoy life as a doctor rather than sitting and burning papers and midnight oil. So I'll stop over here. So that's the process. When you put AI into the system, that's an artificial intelligence. You don't get replaced, but you get less burnout and a better time to go to your beauty parlor and have a good time. Thank you very much.